Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Kriss Marion of Blanchardville is a Democratic candidate in the 17th Senate District. The election is November 6th. Kriss, welcome to WisconsinEye.
Thanks for having me, Steve.
Did you get involved in this because of the cookie bill?
Maybe tangentially.
You were one of those that got the new law written that allows home bakers to sell goods to neighbors in farmers markets. Is that an accurate summary?
No.
Well,
Steve.
fix it. Correct it.
We do not have a law currently.
Oh, it didn't pass?
No, it did not pass, but we won a lawsuit.
Oh,
so
okay. Thank you for the correction.
Yeah, we cannot ban home bakers from selling goods to their neighbors face to face, but we don't currently have a law.
But you won the lawsuit, so
we're still waiting.
These sales are not going on?
Oh, sure they are. I visit farmers markets all over my district, and people come out from behind the tables to give me a hug and thank them. Market managers are delighted to be able to have more vendors at the market. Kale and lettuce are fantastic, and I grow them, but it's tough to have a market without sweets. And in towns like mine of 800, you're not going to have brick and mortar bakeries.
Okay, now this is important, and it gave you a textbook in Wisconsin politics, but it's not your number one issue.
No.
What is your number one issue?
My number one issue is rural places. I love living in Blanchardville. I love Southwest Wisconsin. I just think we have a really bright future ahead of us if we can invest in the infrastructure that we need to thrive.
Well, now on your website, you say that there have been all too many bankruptcies in Southwest Wisconsin. What could you, as one state senator, do for that and to help your rural economy?
Wow, that's a great and a challenging question. I mean, agriculture is a puzzle we've all been working at for forever in America, right? It's a really tricky thing. I think if you look at the nation, agriculture is in a really tough place, no doubt about it. I have people call me and come up to me, talk to me at the doors and say, it's never been as bad as this in our lifetime. So it's a very, very dark time for agriculture. Nevertheless, Western Wisconsin had the most farm bankruptcies in the nation. So something about what we're doing here in Wisconsin with our policy is making it harder for farmers. And I have a fair amount of ideas about that, but I'm also here to learn and to partner with people to hammer out solutions.
How can we, let's turn to healthcare. How can we protect and expand healthcare in rural Wisconsin?
Rural Wisconsin, Southwest Wisconsin, is blessed to have quite a good number of wonderful hospitals. I'm not sure that our problem is access to the hospitals or the providers. Our problem is just the irrationality of the insurance system and coverage. We need to have an affordable and an accessible and really an accountable healthcare system. And I think a lot of that we can solve at a state level.
Does state government have a role in retaining and recruiting doctors, nurses, and other medical professionals?
Absolutely. I've been touring the hospitals, hanging out with the CEOs, talking to nursing professionals, talking to pharmacists. I've got a lot of people on my campaign who work in healthcare, and I am a county board supervisor in Lafayette, so I am in charge of a hospital. We have a county hospital, one of the few left in the state. So this is a topic that we talk about all the time, and the fact is we haven't set the Medicare and Medicaid reimbursements appropriately for our hospitals at the state level. Obviously we didn't take the expansion, and that put us in a difficult position, and I think that sent a message that we're not supportive of those better reimbursement rates, and that is really making it difficult on hospitals, but also on people who have the ability to pay. We are paying that hidden tax.
Cost shifting?
Yeah, it's really difficult for our hospitals to get along. And like I said, I'm super proud of our hospitals. We have great ones.
State government and Delta Dental cooperate in providing funding, dental clinics in low-income areas. Should that be a priority in the next Medicaid budget?
I think so. In Lafayette County, I serve on the county board, but as part of those duties, I'm on the Southwest CAT board. And we talk all the time about the difficulty for lower income folks and our most vulnerable. And let's be clear, at this point, in some cases, that's just people who are between jobs, who are trying to get a better job. There's a lot of young people who are trying to find their way and are not always employed, but doesn't mean they don't want to work, and they're looking for something better. And I've got kids in their 20s, so I know what it's like. And yeah, a lot of people are falling through the cracks, especially on dental care.
Let's go back to, you think the state should apply for the expansion of Medicaid and the federal dollars that would go with it?
I think that would be helpful. The hospitals tell me that that's not the whole solution, and I get that. Some of it's going to be us. We are going to need to fund, we're going to need to agree to do better reimbursement rates. Part
of the healthcare debate involves caregivers. AARP estimates that 578,000 Wisconsin residents are caregivers. Would you support laws or regulations that require hospitals to recognize and work with family caregivers when those they love are hospitalized?
Wow, that's a great question. That has not come up for me before, I have to say. I'd have to do some research about that. But I will say, we in Southwest Wisconsin are aging. We have a very rapidly aging population, and we are going to need to grapple with all of these issues of having an elderly population. Caregivers, transportation is a huge issue for us, getting older people to their appointments. Yep. We are wrestling with that. I'm on the Southwest Regional Planning Commission. We just did a transportation study and kind of saw where the overlap was, where the gaps were. Actually, that's a looming crisis.
But there's an impasse in the Capitol on how we pay for highways, bridges, maintenance. Wave a wand, how would you solve it?
Well, I mean, look, we agreed as a bipartisan legislature to index the gas tax a long time ago, and before
ended in 2006.
Yep, before the roads became a political football, we had agreements. And I think in counties like mine, Lafayette, we just did a rough roads tour. I didn't need the tour. I'm on my rough roads all the time. We have been left behind for the sake of a political dogmatic fight, and that is just fiscally irresponsible. What it's going to take now to get our roads back, our infrastructure that we at one time invested in, to get them back to be usable is going to cost us far more because of inflation and because of how far we've let things go than it would have to just do the right thing, have that tax, and move forward. But now we're going to have a lot more on the table. I know the governor's talking about he's going to roll out a plan at some point. We're all waiting to see what it's going to be. At one point, we were stealing from the transportation budget to fund other things. Now we want to steal from the general fund to fund transportation. I mean, it's goofy, it's bonkers, and we need to just fix it, as they say.
Could you vote to raise the gas tax, the registration fee, or consider tolling, the T word?
I like data. I love data. I really think that we at one time, and the former transportation secretary has come out saying this, at one time we invested in the data in the transportation department to make the best decisions about what need to be done and how we could fund it. And we are not looking at that science right now. I think we're making a lot of politically motivated decisions about our roads, and we just can't. It's our future.
You want to serve in the Senate. Kimberly Clark has given the Senate till September 30 to enact tax benefits, tax breaks similar to Foxconn. If you were in the Senate and there was a vote, how would you vote?
Well, first of all, it's no surprise. We opened the door with Foxconn to start being held hostage by all manner of businesses. I am against, in general, the increasing practice of jamming things through the legislature. I've been someone who has shown up for lots of public hearings, testified on the cookie bill, on water protections, on wetland protections, on roads. I've testified for a lot of things, and everything's rushed. There's not time to get information, and now we're being asked to rush into another agreement with another company. Senator Hansen has a nice proposal for a revolving loan fund that would address the paper mills in general. I like things like that. I'm in county government. We do a lot with revolving loans, and I think that's a nice tool, and I'd like to explore that in a leisurely, measured manner.
Local governments like your county government have been dealing with levy limits for 14 years.
Yeah.
Some local officials say it's hurting the ability to provide local services. Keep levy limits to protect property taxes, loosen them, get rid of them.
I am a small government Democrat, and I take exception to the idea that the state would insult county and municipal and school board officials so much that they want to tell us what our levy limits should be. I'm just fundamentally opposed to that concept. Now, as counties, we literally are mandated to carry out the state. We don't really function outside of the state legislature. We're basically the hands and feet of the state. But to tell us how to do our job, that is just insulting. If you don't like the levy limits imposed by your county supervisors, you've got 2 years to live with them, and you can vote them out. And frankly, we don't have enough turnover at the county level. I mean, look at the age of county supervisors, especially in most rural places. You know why we don't? There's no choices.
Nobody wants those jobs?
Well, I love local government. I say all the time, town supervisors, county supervisors are my heroes for what we have to get done with very little. But that's just an artificial construct. Vote your county supervisor out if you don't like the way they're handling the levy. Vote them out.
Get rid of limits then.
Get rid of limits, and let's create some more excitement and more interest in local government.
The current state budget does include a major increase in state aid to K-12 public schools. Do we need another similar big bump in the next state budget?
I guess major is up for discussion.
200 per student year one, 206 year two is a pretty big bump.
Well, and that gets us to just below 2011 funding levels.
What about the future?
Yeah, I think we need to look at, again, data. And I think we need to prioritize. As someone who lives in a rural community and who wants to represent a rural district, we cannot go on with the funding formula as it is. It's not sustainable. I went to the Blue Ribbon Commission on School Funding, the one that occurred in Fenimore in my district, and I saw grown superintendents cry on the stand as they described what the future looks like in the next decade for our rural schools. And I can tell you that the schools are the jewels of our communities. And we will not have small towns if we do not have strong rural schools. And as the governor says, let's put everything on the table and let's talk about how we're going to get this done.
The voucher program, choice program, has been expanded. Should it expand further?
I am not in favor of expanding the voucher program. I homeschooled my kids half the way, and I did it on my own dime. I was happy to do it. As a citizen of America, part of my participation in democracy is to have an educated electorate. We all put into that. It also is what builds a strong workforce and creates, a wonderful first world country is our education system. So I think it's great to have private schools. I think it's great to have choice, but my parents grew up in projects. They were very poor. They both went to Catholic schools. They were offered scholarships. There was private money raised for that. And that is the privilege of being in that community, is you can raise the money, give a hand up to those kids who need it. And we don't need to do that at a government level.
Our prisons are overcrowded. 2 of them were built in the 1800s. Do we need a new state prison?
I get very emotional when I talk about the correction system. I have met with a number of prison guards. I spent a day standing outside of Sand Ridge Secure Treatment Facility, which is in my district, just waving at cars as they went by. And I had a sign So people knew I was a candidate, and I had people stop and talk to me about what their life is like since Act 10, and since we've been in a position where we can't hire enough guards, and people are working 16s 4 and 5 days in a row. It is, I can't even believe it's legal to run a correction system the way we're running it. I read Ed Wall's book. I'm just shocked and dismayed, and people do not know what is going on at the prisons. Do we need a new prison? I don't think so. Once again, I'd love to see the data. When I'm in the legislature, I will be happy to look at that. But first, we need to look at why we're incarcerating so many nonviolent offenders for drug offenses.
Time to legalize recreational and medical marijuana?
Look, I'm a farmer. And with the farm economy the way it is now, there would be nothing more wonderful for farmers to have another option. We legalized hemp, and then we put a whole bunch of rational regulations on it because of a bunch of superstitions that it was related. And it is, but you literally can't grow hemp and marijuana in the same field because it ruins your very valuable THC crop. So it's irrational. We have these, and you know I'm not a fan of irrational regulations. We have irrational regulations surrounding hemp right now. But if we were to do some research, we've got lots of states that have legalized medical marijuana. We can see how things are going for them. We have information available to us, and I think absolutely let's get medical marijuana on the table. We have this opioid crisis we're trying to come out of. We're tightening down on pain medication, and I have pharmacists telling me we need the medical marijuana option for pain management for people. I've got a lot of veterans I'm friends with, and they tell me the same thing. So we got to move on this. We're behind, and we're not giving our farmers an opportunity. I will say, I've encouraged my friends who are very into this to not push too hard under this administration because we are very pro-big business, and I'm anxious for small, medium farmers to be able to get on the growing opportunity and not have it go corporate as it has in many states already.
Finally, you're challenging a Republican incumbent. Biggest differences between you and your opponent?
Well, our budgets are very different from each other. It's kind of a David and Goliath story. But I will say I am a small business owner, and I'm a county board supervisor. I'm the only person in this race who has small business experience or county government experience. My opponent came up working for a Madison CPA firm, and we have vastly different world experiences. I live and work every day in a town of 800. I've built an award-winning bed and breakfast that has been featured in 7 national magazines just last year. And I've built a network of women farmers who help each other innovate and learn. And I know what it's like to make it work in a rural community. And I think that's a real different set of skills that I bring to the table than my opponent.
Thank you. Kriss Marion of Blanchardville, the Democratic candidate in the 17th Senate District. The election is November 6th. Kriss, thanks for talking to WisconsinEye.
Thank you so much, Steve.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.